Welcome to Adapt NCLEX, video number 4 on our series Pharmacology Practice Test. Today, we're talking about respiratory drugs that are commonly tested on the NCLEX in a nursing school exams. I'm going to use 15 questions, NCLEX review questions, NCLEX questions and answers to show you these medications that shows up in the simple, straightforward, memorable way, concise answers and explanation. Stick around and let's get to it. First question, as you can see, try to make it a little bit difficult this time so that we can get this medication mastered no matter what. But this question is intimidating. Don't worry. Select or apply. New generation NCLEX. Pick those that you're 100% confident. It's a prioritization question. Let's get to it. A nurse is reviewing a list of clients receiving respiratory medication. Which situation require the nurse to intervene? Select or apply. How do you answer questions? Start from the back. Select or apply. New generation NCLEX. You know you're not supposed to pick all of them. You pick those you're 100% confident. What is the problem? Intervene. Something is not right. They are all medications associated with the respiratory system. Sex patient, whose situation you should worry about. Theophylline. Why? What is happening? Who report drinking 4 cups of what? Caffeine daily. That's one patient. Second patient is on Albuterol has a heart rate of 102. A client on what? Ipratropium, who has what? Peanut allergy. A client using salmeterol as a rescue inhaler for sudden wheezing. A client on what? Prednisone, who has blood glucose of what? 165. A client on Methylxanthines, who is experiencing what? Nighttime asthma symptoms. How do you answer prioritization question? Divide it into 2. Ask yourself the first portion and the second portion. Second portion is very important. Look at what is happening to the situation. If you're on theophylline and you're taking 4 cups of caffeine a day, you are in trouble. Lead to toxicity of theophylline. A client on Albuterol who has a heart rate of 102. What is going on? Albuterol is a beta agonist. It will speed things up. You expect the heart rate to go up. 102 is not that bad. We don't need to intervene. Ipratropium, who has what? Peanut allergy. Ipratropium is anticholinergic used in acute situation of asthma. If you're allergic to peanut, you cannot take it because some of the components has peanuts in it. Therefore, you should not take it. Using salmeterol as a rescuer inhaler for sudden wheezing. The last name is raw. It looks like Albuterol, but it's not a rescue agent. It's for what? Long acting. Salmeterol should not be used as a rescuer or a sudden wheezing. Therefore, this patient needs some teaching regarding the use of what? Salmeterol. So that question, we need to intervene. A client on prednisone who has a blood glucose of 165. Steroid increases your glucose level. This is an expected finding. We don't need to do anything. A client on montelukast who is experiencing nighttime asthma symptoms. Same thing. Montelukast is for long term. If you are experiencing asthma symptoms at night, you need a rescue agent. This patient needs some teaching. Who we should intervene? Number 1, number 3, number 4, and number 6. This is the first question. But as you can see, it's content-based. You have to identify the medication and then pick the right answer. Number 1 is that. Number 2, which finding on the EKG should the nurse report to the provider? A nurse is caring for a client receiving what? Frequent Albuterol nebulizer treatment for acute asthma exacerbation. Which finding on the EKG should the nurse report to the provider? Think about it. Sinus tachycardia with a heart rate of 105. Occasional premature ventricular contraction. Flattening T waves and the presence of U waves. Normal sinus rhythm. The answers are intimidating. Don't worry. Break down the question. EKG finding, you should report to the provider. Those are the 2 buzzwords. The next buzzword is Albuterol, frequent Albuterol. Then ask yourself, what is Albuterol? It's a beta agonist. If I give it to you, your heart rate goes up, 105. Do you get premature ventricular contraction? It said occasional there. Don't worry about it. Flattening T wave. How does that happen in the presence of U wave? Normal sinus rhythm. That tells you number 4 is gone. Number 1 is suspected finding. Number 2 and number 3, you can see occasional premature ventricular contraction and a pure flattening T wave in the presence of U wave. What is happening? Albuterol causes hypokalemia. Don't forget, write it down. Albuterol causes hypokalemia. Write it down. Therefore, the presence of U wave and the flattening T wave, those are signs of what? Hypokalemia. EKG changes are more serious in this situation compared to occasional premature ventricular contraction. 3 is your right answer, but this is a content level regarding Albuterol. Don't forget, let's recap again. Albuterol causes hypokalemia. Therefore, watch for these signs on EKG. Which instructions should the nurse include during discharge? About who? The nurse is caring for a client. Prescribe what? Albuterol. It's a rescue agent. Albuterol is a rescue agent. Use this inhaler daily in the morning. Wait for 5 minutes before using the steroid inhaler. Expect drowsiness after each dose. Clean the inhaler mouthpiece weekly. Stop the video, answer the question, put down your answer, and then listen to me how I'm approaching it. The only way I approach it and the best way is to go to the Albuterol. That's my buzzword. I look at Albuterol and say, what should I include in teaching? A big beta agonist is going to speed things up. It's going to make everything goes up. Why would I be drowsy? No, I'm not going to be drowsy. I'd rather be more alert. I can't sleep. Tachycardia. Therefore, 3 is not expected. Use the inhaler daily in the morning. It's a rescue agent. You don't take it every day. You see, those are the trap, right? You don't take it every day. Wait 5 minutes before using the steroid inhaler. Yes, you got to open the tube when you have asthma exacerbation, the bronchodilator before inflammation. So A before S. So wait 5 minutes before using the steroids. So if they use the inhaler, you should wait for a couple of minutes before they use the steroids so that the Albuterol can take effect. Clean the inhaler mouthpiece weekly. You need to clean it more frequently, maybe 3 times a week. Therefore, number 2 is the right answer. A nurse is teaching about salmeterol. We've seen it. It's used for what? Long acting, which client management indicate the need for further teaching. They don't understand a long management medication. You see the way I'm approaching it, breaking it down. Management, NCLEX review questions, NCLEX question and answers, using fundamentals of test-taking strategy to help you master these respiratory drugs in these questions. You can see, I hear about salmeterol. The first thing I tell myself, long acting. If I need further teaching, they're not doing something regarding what? Long acting. I will use this when I start wheezing. Think about it. This medication will help me during an asthma attack. I will take it twice daily for a long-term control. This replaces my rescue inhaler. I will still need to carry what? Albuterol with me. These questions shows up on the NCLEX. The concept I'm using is the same thing they will write when they're trying to test you about salmeterol. So watch these questions, pay attention, and know how they're going to trap you. Further teaching regarding salmeterol. I will use this when I start wheezing. Negative. You should not use it. It's not a rescue agent which you intervene. This medication will help me during an asthma attack. 1 and 2 are saying the same thing. If you pick 1 as an answer, pick number 2 because it's talking about acute situation. I will take it twice daily for a long-term control. You can see 3 contradict 1 and 2. Therefore, 3, it does not need further teaching. It's a good thing. It means long-term management. This replaces my rescue inhaler. No, he's saying the same thing as 1 and 2. It doesn't replace your rescue inhaler. It's used for long-term management. I will still need to carry Albuterol with me. That means I will still need a rescue agent, and that is true. Therefore, which one need intervention? 1, 2, and 4. Thank you for watching. And you can see how I'm approaching it. I want you to master this pharmacology, respiratory drug, respiratory pharmacology test. A client using inhaled steroid is a steroid. The name does not matter. Ask how to avoid side effects. What should the nurse emphasize? Increase fluid intake. Avoid diarrhea with the inhaler. Use a spacer. Take the inhaler only at night. Think about it. I'm inhaling steroid and I want to prevent what? Complication associated with it. Fluid has nothing to do with the steroid. It has no correlation with that. The only thing that delivers the steroid is a spacer. You can use the spacer or not. Therefore, if I use the spacer, it's going to concentrate it and get me into where enough medication into the lung to help me find symptoms. Therefore, that one is more important than avoiding diarrhea with the inhaler. It does not answer the questions whether it make it effective, and there's no correlation. Take the inhaler only at night. You're supposed to take it twice a day. Therefore, 4 is wrong. Number 2 is the right answer. So the next question is what? Number 6. A nurse is providing teaching instruction to a client with a new diagnosis of asthma. Which method the nurse should instruct the client to avoid? There's certain medication, if you have asthma, you should never take it because it's going to worsen your situation. Is it NSAID? Is it Mucolytics? Is it acetaminophen? Is it Methylxanthines? And is that Albuterol? There is concept regarding each answer choice. Stop the video. Tell me how many answers you've answered so far. We are on number 6. Did you get 6 out of 6 or 5 out of 5? Let's get to it. NSAID is not good. It can lead to what? Polyp, nasal polyp, and worsen the asthma attack. Therefore, they should avoid it. Mucolytics will give them more secretion. There's no secretion in asthma that can cause bronchospasm. They should avoid it. Acetaminophen is good. If you avoid NSAID, then you should take acetaminophen. Methylxanthines is what? Beta blocker. But what? It's a selective beta blocker, which is good in asthma. Balm is good in asthma. That means what? Misoprolol, atenolol, and metoprolol. These are medications that asthma patient can take, even though it's a beta blocker. And Albuterol can cause cough, and this cough can worsen asthma attack. You see, you know the content, but I'm putting it back together to be able to answer this question. These are concepts. NSAID, Mucolytics, and Albuterol, ACE inhibitor, which causes cough, should be avoided in asthma patients. Number 7, which statement indicate effective understanding? That means they know what is going on. A client is prescribed what? Montelukast for what? Asthma prevention. Key things about this medication is for long-term management, is used for exercise-induced asthma and allergic rhinitis. Therefore, these medications very important. Based on that, what do you think? I will use it when I feel short of breath. I will take these before exercising to help me prevent symptoms. This medication acts immediately to stop wheezing. I will carry this at all times in case of emergency. Think about it. Put down your answer. I give you the content from the beginning. It's used for long-term, exercise-induced, and allergy-related asthma attack. You cannot carry it all the time because it's not used for emergency, right? I will use this when I feel short of breath. It's not used for emergency. 1 and 4 saying the same thing. I will take this before exercise to help prevent my symptoms. Prevention. This medication acts immediately. It's not the rescuer. Therefore, 2 is the right answer. And this is caring for a client prescribed what? Theophylline. This is also what? Beta agonist. But they're different from Albuterol. They are long-term beta agonists, which findings should the nurse report immediately. What does beta agonists do? They speed things up. What do you think? Restlessness, nausea, tremor, heart rate of 65. What do you think? Heart rate of 65 is normal. Tremor, things are going up. Nausea, things are going up. Restlessness, things are going up. But don't get trapped. Just because you see restlessness and you know a certain system is very important in this situation, it's not because it's due to beta agonist. Tremor too is that, but tremor take precedence in this situation because it indicates more to what? Theophylline toxicity than restlessness. So number 3 is your best answer choice. And let's prepare to administer budesonide, right? Budesonide via what? Nebulizer to a client with asthma. Which intervention should the nurse implement to ensure proper medication delivery? This is just asking you MDI, medication delivery of steroid using what? Nebulizer. There's teaching you have to provide for the patient when they're using it. Should they avoid tapping the nebulizer chamber during the procedure? Medication administration fundamentals here. Have the client rinse their mouth after the procedure? Same thing, right? Assist the client to a sitting position greater than 45 degrees. Place the mouthpiece between the client's lips. Instruct the client to perform deep breathing before the treatment. Pharmacology test. Put down your answer. This is NCLEX review as we review the content and we do NCLEX questions and answers. So what do you think? What do you think? What should they do as they teach the individual to implement proper medication administration? This is a concept. Avoid tapping the nebulizer chamber during the procedure. It's not a good teaching. They should tap it rather. Tapping it allow the medication not to stick inside the wall and deliver enough amount into your lung. Have the client rinse their mouth after the procedure to prevent what? Trash. So that's good, right? This is to proper assist the client to in the sitting position greater than 45 degrees. This allows your lung to expand and take all the medication. Place the mouthpiece between the client's lips to make sure it's really, really tight. Instruct the client to perform deep breathing before the treatment. This can be a trap. A lot of people may pick this, but deep breathing is done during, not before. You take deep breathing during the inhalation, not before the treatment. Therefore, number 2, number 3, number 4 are the proper teaching. The client is using mid-dose inhaler, MDI, with no spacer. These answer the same questions as the previous one. If we know it, we can answer this. Which action by the client requires correction? That means intervention. Shaking the inhaler before using is the same thing like tapping it so they can mix well. Inhale slowly when pressing the canister, like the last question where the inhalation occurred before, and I said it should occur during. Holding breath for 10 seconds after inhaling to allow everything to go in. Exhaling immediately after pressing the canister. That means you're pushing all the air out. You need to give yourself time to do that. Therefore, which one is the right answer? Number 4 is wrong. You should not exhale right away. It's a slow exhalation to allow wait. At least you got to wait a few seconds then before you can exhale. Number 11, once again, are you keeping track of it? How many questions have you had? Do you remember all these medications you've seen and the key fact about them? And then caring for a client with what? COPD prescribed Ipratropium. This is what? Anticholinergic. What is used for? Fast acting. Therefore, used in acute situation. Which side effects should the nurse monitor for? It's anticholinergic. It does not cause hypotension. It causes dry mouth. It does not cause sedation. It does not cause hypoglycemia. What do you worry about? Number 2. The nurse is teaching the client how to use guanfacine. Which instruction is most important? You have to know what is guanfacine. Take a look at the answers. Take it at bedtime to listen secretion. Drink plenty of water throughout the day. Avoid taking with food. Limit use to once daily. What do you think? Have you heard about guanfacine? I know you've heard about it. You've taken it over the counter. Are you using the proper method? This question demonstrates that. The key concept to answer, guanfacine is expectorant, right? It helps thin and loosen your mucus, and you need fluid to be able to do that. Even water activates guanfacine, therefore it's needed for its activity. If you take it at night, you're going to have more secretion and you cough and you're going to worsen your night sleep. Drinking plenty of water is needed to allow the guanfacine to work. Avoid taking with food. There's no indication that you can take it with food or without food. Limit use to once daily. You take it every 4 to 6 hours. So you don't need to limit use to once daily. Therefore, the right answer is what? Number 2, drink a lot of water. And let's review discharge instruction for a client prescribed what? Cromolyn sodium. Which statement shows understanding? This is a good medication you shouldn't forget. It's a mast cell stabilizer. It's like leukotriene, but they act differently. They are very preventive. They are used for long-term use. That's the thing. Long-term is use preventive measures, right? Not acute situations. So look at the answer choice that says something out of the ordinary. I will use the medication for a quick relief. No, it's not for rescue. I will take it every day to help prevent attack. Sound like better idea because it's for prevention. It will help loosen my mucus. It's not guanfacine. I will take it only when I feel wheezing coming on. It's not the rescue agent. Therefore, the right answer is, as you can see, every day to prevent attack, number 2. And then she's preparing to administer IV aminophylline to a client with asthma, what should the nurse monitor closely with? If you don't know, remember this, aminophylline, we saw theophylline, and theophylline, aminophylline are the same. Pharmacology audio, remember them, pay attention to the last name. I see aminophylline and I know theophylline. Whatever I know about theophylline, I should add it to aminophylline. What you worry about is a beta agonist. And beta agonist is speed things up, right? And they're going to do what? Your blood glucose may go up. Your respiratory rate may go up. It does not affect your sodium and potassium. But what would they do? What is the most important thing regarding this medication right here? This medication, very, very, very important. It causes seizures. And the first thing you should worry about is seizures regarding aminophylline. Therefore, that should be the right answer. 15, last one. Think about it. Stop the video. Answer this question. Put down in your answer. This is a straightforward, but I want you to know this drug, acetylcysteine. A client with what? Pneumonia is prescribed acetylcysteine. What is the intended effect of this medication? Reduce inflammation, suppress the cough reflex, loosen and thin mucus, dry up secretion. Acetylcysteine, if you don't remember it at all, is used in cystic fibrosis. What does cystic fibrosis have? Too much mucus. Therefore, how should I take care of the mucus? Break things down. Therefore, what is the function of acetylcysteine? Loosen and thin mucus. It does not reduce inflammation. It doesn't suppress your cough reflex. It doesn't dry up. It's designed for what? Luxing. That's why we use it for cystic fibrosis. 15 questions, NCLEX review questions, NCLEX questions and answers on pharmacology tests, respiratory medication that shows up on the NCLEX. Thank you for following the series and good luck.